Blepharoplasty. In recent years, blepharoplasty has become a very common surgical technique, especially among men. At his clinic, Dr. Moises Martin Anaya has been treating all types of patient needs using the latest medical advances for 15 years. The appearance of bags on the eyelids, the drooping of the eyebrows, and wrinkles generally produce an undesirable look of tiredness and age. Eyelid surgery attempts to correct all of this to give you a younger, sunnier gaze. Nevertheless, an evaluation by our medical team of the patient's expectations are extremely important, with clear and personalized advice about the results that can be achieved. At the clinic of Dr. Moises Martin Anaya, we perform a rigorous preoperative evaluation of the ocular and lacrimal functions. The lower eyelid is examined to detect the presence of excess skin and fat. The ocular globe and the rest of the orbital structures are surrounded by fat, which in the front is contained or held in place by the orbital septum. This orbital fat is held in packets or bags, 3 in the case of the lower eyelid and 2 for the upper. With the passage of time, the orbital septum provides progressively less containment, causing the bags to bulge and giving rise to the well-known palpebral bags. Similarly to the excess fat, the excess skin contributes to an older look, and therefore the treatment must always be targeted to the specific component causing the problem. Sometimes the drooping of the eyebrows is great enough to require a brow lift, with or without blepharoplasty. The intervention is performed in hospital under local anesthesia, with or without sedation, on an outpatient basis. In general lines, upper eyelid surgery is based on the elimination of excess skin from part of the orbital muscle and internal fat. The resulting scar will be hidden in the crease of the upper eyelid, which must be located preoperatively. An incision is made in the lower eyelid approximately 2 millimeters from the lash line. The fat deposits are removed, and as a general rule, it's important to be conservative in the elimination of excess skin. If the lower eyelid is very droopy, we can tighten it by using different techniques. In young patients with obvious bags but without excess skin, we can use an incision that is not visible. Dr. Martin Anaya recommends rest and the local application of cold compresses in the first 24 hours. It's normal for there to be bruising and swelling of the eyelids. During this period, it's common for there to be excessive tearing and some intolerance to light, in which case your surgeon would prescribe the appropriate eye drops and medication and advise you to wear sunglasses. The location of the incisions makes them difficult to see after a few months.